soft inhale. Let's begin with a fundamental truth. Blackheads aren't dirt or a sign of uncleanliness. They're a mix of your skin's oil, called sebum, and dead skin cells in a pore. When exposed to air, it oxidizes and turns dark. It's a normal process. Pimples are inflamed pores, blocked and trapping bacteria, which triggers an immune response. The goal is never aggression. We'll clear both with a gentle system I call clarity. It's built on sequence and low pressure, not force. This is about working your skin, not against it. First, C, condition and soften. And here's our first myth bust. You don't open your pores. Pores aren't muscles. We're actually softening the hardened plugs of oil and debris inside them. Take a clean washcloth and soak it in warm water, not hot, around 105 degrees Fahrenheit or 40 Celsius. Too hot, and you risk irritation. Wring it out so it's damp, not dripping. Gently press the warm towel onto congested areas for 2 full minutes. You may need to rewarm it. If you have a facial steamer, use that for 2 to 3 minutes, keeping it about 8-12 inches from your face. The goal is to make the contents of the pore pliable, like a firm marshmallow becoming soft. This simple step is crucial for making extractions easier and safer. Next, L, liquefy and lift. This is the double cleanse, starting with an oil cleanser on skin. Applying oil to dry skin allows it to bind directly with the oils in your pores, dissolves. Dispense 2 to 3 pumps and gently massage it into your skin for a full 60 seconds, focusing on the areas you just warmed. Use small circular motions. This isn't scrubbing, it's letting the oil do the work. Now, add a little lukewarm water and continue massaging. The oil will emulsify, turning milky. This allows everything to be rinsed away cleanly, without residue. Rinse thoroughly. Follow immediately with your second cleanse, a 60-second wash with a gentle water-based gel cleanser. This removes any remaining oily residue and water-based impurities. For congested, non-sensitive skin, you can use a gentle BHA gel cleanser. If your skin is more reactive, choose a soothing formula with ingredients like heartleaf or green tea. After rinsing, your skin should feel clean and soft. Your fingers should glide over it. If it feels tight or squeaky, that's a sign of a stripped moisture barrier. Your cleanser is too harsh. Now, A, assess readiness. This is your traffic light system. Green means go. This applies to a raised, open blackhead where the plug is at the surface, or a whitehead with an obvious, defined white cap. These are the only candidates for release. Yellow means caution. This is a closed comedone, a small, flesh-colored bump. There's no visible opening. Popping these will lead to inflammation and scarring. Treat them with topical actives, not force. And red means stop. Absolutely hands off. This is a deep, painful cyst or an inflamed cluster. These are deep infections. Squeezing will spread bacteria, worsen inflammation, and guarantee a scar. These require patience and targeted treatments. R, release, but only the ready. Only green light, blemishes. You have 2 safe options, a sanitized comedone extractor or your fingers wrapped in clean tissue. Never use bare fingernails. Always sanitize your tool with alcohol before and after each use. For a blackhead, gently stretch the skin taut. With your other hand, place the loop of the tool, just the blackhead. Then, apply very light pressure and slowly roll the tool back over the pore. The softened plug should glide out easily. If it doesn't, it's not ready. For a ready whitehead, use 2 cotton swabs. Place the tips on either side of the pimple at a 45-degree angle. Gently press down and in, then roll upwards. This coaxes the contents out, rather than pushing them deeper. Never pinch the skin, as this damages surrounding tissue. And always follow the rule of 2s. Give it 2 gentle tries. If the contents don't release easily, stop. Your skin is telling you it's not ready. Forcing it will cause trauma and hyperpigmentation. I, inflame down. Immediately after a release, provide microcare. Gently sweep the area with a sterile saline solution, pat dry, then apply a tiny dab of a 2% salicylic acid solution directly onto the opening to help keep the pore clear. Now, calm the inflammation. Gently press a soothing serum into the skin. Look for ingredients like Centella asiatica, also known as cica, for healing, heartleaf for its anti-inflammatory properties, or panthenol to hydrate and repair. For any whiteheads you treated, cover them with a hydrocolloid patch overnight. This creates a moist, protected environment that speeds healing and prevents picking. If the area is pink or warm, wrap an ice cube or chilled roller in a soft cloth and glide it over the area for 30 seconds. This constricts blood vessels and provides immediate relief. T. Targeted actives. This is your treatment plan for 2 to 3 nights a week, on non-extraction nights. For inflammatory pimples, use short contact therapy. Apply a 2.5 to 5% benzoyl peroxide wash as a mask for 60 to 90 seconds before rinsing. Or, use a thin film of a 5 to 10% sulfur mask for 5 to 10 minutes, then rinse. Both kill acne bacteria with less irritation than leave-on products. On nights you're targeting blackheads and closed comedones, use a leave-on BHA liquid with 0.5 to 1% salicylic acid. Press it gently into the skin. This will work inside the pore to dissolve blockages over time. The most important rule here, do not stack strong actives. Never use a leave-on BHA, a leave-on benzoyl peroxide, and a retinoid all on the same night. This is a recipe for a compromised barrier and more breakouts. Which brings us to why, your weekly rhythm. Skin cycling is key. A simple routine looks like this. Night A is your treatment night for texture. Use your BHA, then follow with soothing, hydrating layers. Night B is your cell turnover night. Use your retinoid, whether it's a gentle retinol or prescription tretinoin, and follow with a nourishing moisturizer to buffer potential dryness. Night C is your recovery night. No actives. Focus entirely on barrier repair with gentle cleansing, hydrating serums, and a ceramide-rich moisturizer. Then, repeat the cycle. This rhythm gives your skin time to benefit from actives and time to heal. What can you expect? Within 24 to 48 hours, treated whiteheads will be calmer and flatter. After 1 week, you'll notice a smoother texture. And within 4 weeks, you'll see a meaningful reduction in new plugs and blackheads. Patience is part of the process. Remember, clear skin comes from a thoughtful sequence, not from force. For persistent inflamed cystic acne, it's always best to consult a board-certified dermatologist. But for common congestion, this gentle, consistent approach is your key. You've got this.